Have you ever wondered how trust in vaccines has evolved over time and what it means for our communities today? In the quiet corners of rural southeastern Alabama, pediatrician Nola Ernest faces a challenge that echoes across America. For years, she has been a trusted voice for families deciding on vaccinations, often sharing her personal choice to vaccinate her own children. Yet recently, even those who once followed her recommendations are hesitating to vaccinate their newborns. "We still trust you," they assure her, yet express concerns about vaccines being unnecessary or harmful. This shift is not just an isolated incident but part of a broader narrative influenced by prominent voices like Health and Human Services Secretary Robert F. Kennedy Jr., who questions the safety and necessity of vaccines. A recent survey highlights this growing dichotomy. While many Republicans trust their physicians for vaccine advice, a comparable number also trust figures like Kennedy and former President Donald Trump. As these influential voices diverge, the trust that patients place in their doctors is increasingly at odds with governmental narratives. This tension is palpable in doctors' offices nationwide, where some conversations lean towards vaccine hesitancy, while others rush to vaccinate before potential restrictions arise. The current discord between government advisories and medical professionals is not unprecedented. Back in 1989, differing recommendations on the measles, mumps, rubella vaccine prompted the CDC and the American Academy of Pediatrics to harmonize their advice by 1995. However, today's debate is more profound, centered not on timing but on the validity of evidence itself. Kennedy's recent actions, including dismissing members of the CDC's Advisory Committee on Immunization Practices, ACIP, and introducing skeptics into its ranks, have intensified this divide. The subsequent vote to remove flu shot recommendations underscores a radical shift from evidence-based policy. The consequences are tangible. Pediatrician Molly O'Shea in Michigan observes a noticeable decline in vaccination adherence among her patients, a trend fueled by doubts sown through public discourse rather than online rumors alone. Families have really been shaken in their confidence, she reflects. Why does this matter? When trust in vaccines erodes, community health can suffer as preventable diseases gain ground. For some families, Kennedy's rhetoric resonates deeply enough to question long-held beliefs about vaccine safety. Others fear dwindling access to vaccines under changing policies. Gretchen LaSalle in Spokane notes an urgency among patients anxious about future availability of seasonal shots. As we navigate this landscape fraught with doubt and division, it's worth asking ourselves, how do we discern whom to trust when expert opinions clash? The decision to vaccinate is deeply personal, yet profoundly communal, impacting not just individual families but public health at large. In these moments of uncertainty, perhaps our greatest ally remains open dialogue between patients and healthcare providers grounded in empathy and understanding. As doctors like Ernest continue their commitment to patient care amidst these challenges, they remind us that at its core, healthcare is about people helping people. So as you ponder your own choices or those for your loved ones, consider this. How will you balance skepticism with science? And how might your decisions shape not just your family's future, but that of your community?